strengthen the quarantine. Now, all those who are contacts of the people who have tested positive have to be taken for quarantine. And I think we need to understand how this thing works. Right now, when you've got a raging outbreak, such as what we're seeing here, the crux of the matter is what do you do to break the cycle? And to break the cycle, you have to make sure whoever is either positive and has got symptoms or just positive and infective must be put into isolation bed. The ones who are associated must be kept in must be taken for quarantine. That means that the two possibilities that there were to spread the infection is limited. Then the people who are doing community screening will go out and see if anyone else has still got the infection or is exposed. It's important to take the people out of the community for a period and then take them back once that period of risk of infection has been reduced. That is what needs to be done. And so we've discussed this issue. The province is working very well, is working very well to make sure that they find additional places for quarantine, and we're going to insist on that. But I must make a point at this stage that the province has worked on a plan which is very much aligned with what's going on at a national level, of looking at various levels of alertness in terms of the level at which the level of spread of the infection and the readiness of the department and the need to manage the community activities, so social activities in the particular area. It is important for us to indicate that Western Cape, but particularly Cape Town, is one area that we could classify as a hot spot. That means that there's a higher rate of infection. If I look at it, I've got about 8 of our metros that have got that problem. So it will be Cape Town, it will be Johannesburg, it will be Tshwane, it will be Ekurhuleni, it will be Mangaung, it will be Nelson Mandela Bay, it will be Buffalo City, East London, it will be eThekwini, and then Mpumalanga somewhere in KwaZulu-Natal. These areas are areas where we're seeing a very high rate of transmission. That means that when we move forward, there are areas where they've not had districts. Of the 52 districts, there are many that have either had very few people who are positive or none. Now, when we now ease the lockdown, there are others that are going to move faster towards normal activities, but there are others that are going to remain behind. So we should expect that in areas such as this one and the other metros, that there should still be lots of restrictions that could be considered, because we now need to focus on area by area. And I was quite impressed as well, because I've asked for the MEC to show me the breakdown. When you go into that level, you go to a city and you go ward by ward, block by block, to look at where the real problems are. You must therefore create a containment strategy based on public health policy approaches into that area. So that's what's going to have to happen in Cape Town. So when there's going to be need for restrictions, we want our people to understand that there's going to be need for restrictions in certain areas. We haven't made any determination. We're just simply saying that the approach going forward is going to require that there's a differentiated approach to the relaxation of activities and return to normality. It can't be the same.